Okay, let's give a round of applause for Mila for being here with us today. Thank you. All right, take it away.
Thanks for the introduction. So thank you for being able to give a presentation here. I am Mila Poelhekken. I work at the Alreine Hospital in Leiden, and I'm a dermatologist in training. So I'm here on behalf of the tattoo clinic that we have, together with my colleague Sebastian van der Bent, who could not be here today, unfortunately, but he's a very big expert on possible complications in tattoos. I would like to start by telling that we are not trying to suggest here that tattooing is harmful. On the contrary, actually, I'm very impressed by all the skill and artistry that I see around me here. I actually have 2 tattoos myself, but I think it's very important that we come together to recognize possible complications and symptoms and refer them to the right care if needed. So it's not allowed to make pictures of the pictures in the presentation because of the privacy rights of the patients, but also the magazines. The tattoo clinic, I will shortly tell you something about it. It's a specialized knowledge center in the Netherlands, in Leiden. We have patients from all over the Netherlands, but also from Belgium and Germany. So we don't do cosmetic tattoo removal, but we do give advice on how to remove the tattoos. Normally we see patients who have complaints from their tattoos, and we can give them treatment, sometimes even systemic treatment, to help them recover. So today, what I'm going to tell you is what kind of complaints we see after tattooing, also the complications, and the possible treatment, briefly, and then some tattoo removal complications. So we all know that tattooing is an intradermal injection. And in the Netherlands, in 2015, around 11% of the people was tattooed. And now there was a new research done, and it's now 30%, so it's growing rapidly. And it's around the same numbers as in Europe and the USA. Half of the people that have tattoos have more than one. And women are slightly more often tattooed. And in Holland, there's about 3,000 tattoo shops and beauty salons that tattoo. So many tattoos are associated with complaints. The reported figures are vary widely. So up to 9% of the people report symptoms after 1 month, but up to 27% within 3 months. So it varies a lot in the literature. A majority of the complaints are sun-induced, mostly mild, mostly itch or pain, and 6% of the people reports long-lasting complaints, and 2 to 4% gets a dermatological diagnosis, mostly with us. So I'm not going to tell you all about this, but this is everything that is reported in literature, so all the possible complications. And I'm, of course, not going to tell all these complications, so I made a classification for you. We'll start with the inflammatory complications, like allergies, autoimmune diseases, or chronic inflammatory black tattoo reactions. The infections, the skin cancer and tattoos, and then some other complications. Okay, so I'll start out with the allergic reaction. It's very rare. We don't see this very often, but it's a very important one because it's where you put on a cream and you have an allergic reaction, you can just wash it off. But here it's intradermal, so it stays, it's persistent. We mostly see the delayed allergic reactions, the type 4. And what is important is they can occur weeks to years after tattooing. And on average, the complaints start 1 year after you have a tattoo. It is recognizable by chronic itch, pain, and edema of the tattoo, but it varies a lot in presentation. We're going to show you some pictures after this slide. And because it's persistent, it's really reducing the quality of life of the clients. It's a sharply defined, mostly around one color. It's possible in all colors, but the most common one, as we probably all know, is red ink. And the triggering factor can be sun exposure. These are some of the sayings that we hear. It's not so an allergy in a tattoo can also happen, and happens most of the time, even when a tattoo is completely rightly put. So it's not just cheap inks from China, but also inks in Europe. So here we can see a very typical image of a red tattoo allergy. Here we see that it's also possible in PMU. And this is very, very difficult to treat as well, because it's in the face. Also with lip lining. And you can see that it varies a lot in presentation, because here this patient had a really hyperkeratotic allergic reaction. And they also sometimes come with ulcera, even in the FC Barcelona sign. Here, this one has a really ulcerative allergic reaction. This is really damaging for the skin, and it heals with scarring. And even the best club in Holland, although here in Eindhoven, I think they'll be happy to see this one removed. So that's about the allergic reactions. And another thing we see at the clinic, the tattoo clinic a lot, is the autoimmune diseases. Sometimes a tattoo can be the first presentation of an underlying autoimmune disease. And that is because you bring the form, so the ink is not from your own body, and then sometimes can be the first presentation of something underlying. We call this the Kupner phenomenon sometimes. This is what you can see in the picture. I'm not sure if it's very clear, but you can see that the psoriasis is very confined to the tattoo, and it's because of the trauma of the needle that psoriasis comes there. If we have a suspicion that it can be an autoimmune disease, we always check also the lungs and the blood work, because it can be systemic as well. So here I have another example of the psoriasis in a tattoo. It was actually directly after tattooing that he got this. The lichen planus is also a Kupner phenomenon, so it's also directly after tattooing that these kind of lesions were there. And then this is one actually different category within the autoimmune diseases. It's the one we see the most at the tattoo clinic. It's the chronic inflammatory black tattoo reactions. And they can be, most of the time, they are non-sarcoidal. But sometimes they can be a sign of sarcoidosis. This is an autoimmune disease that also can affect the lungs, but also even neurology. And it can also be a sign of uveitis, which is an eye disease that can cause blindness. So this is one that we are always, if we see this, we always check the lungs and the blood work. What we see is probably elevation in the tattoo, mild itch and pain, and it's most of the time very long after we put the tattoo was set. So sometimes even after 18 years, this can be present. These are some of the pictures, and what I want to show you with this picture is actually how similar they are. So you can see A, B, and D are all the chronic inflammatory black reactions, and C is the sarcoidosis, and the rest is not sarcoidosis. But it's not possible to make this distinction based on the clinics. So here we can see sarcoidosis in a tattoo. And also PMU, this was a very hard to treat case as well. So I think what I wanted to make clear with the inflammatory reactions in tattoos, it's very important with a swollen tattoo, black tattoo, that you also refer to a doctor to see if there's not systemic involvement. Then, of course, infections, I think you guys will see these more than we do, because normally these are solved in the GPs or tattoo shops themselves. We don't see them very often in the clinic. but they are the most frequent complication. So most of the time it's of course contamination, sometimes from insufficient disinfection of the needle of the skin. Sometimes the ink is contaminated and sometimes the aftercare is the problem. Most of the time they're superficial, easy to fix, but they can be very deep. There can also be mycobacterial infections, lepra, syphilis, and also the viral infections like Verruca vulgaris or molluscum, but also of course the hepatitis B and C. So this is a very superficial infected tattoo, but what you can see is that the after picture, the pigment is a bit fake. It's a bit blurred. So that is one of the reasons that we want to treat it timely. Here we can see a viral infection in the tattoo. That's the first picture. You can see all these warts actually just precisely at the tattoo. And the second one is like a bacterial infection. The infection can become systemic. So then we really have to treat it with oral antibiotics. This is very important to recognize because this really needs to be treated. And in the picture with the blue back, you can see there's a mycosis, a fungus, and then another viral infection. So you can see that these infections, they vary a lot in presentation, but it's very important that we recognize them and treat them before it becomes systemic, and also to maintain the tattoo. This is the skin cancer and the tattoos. There's a lot of information found and also a lot of literature about this. So what I first want to tell is that there is no study that showed a relation between skin cancer and tattoos. Also not lymphomas and tattoos. It's all because there was one article that proved an association with lymphomas and tattoos, but this was retracted, I think this year. Okay, so there has been a shift in the pigments used in tattoo inks, but in countries such as Germany, Denmark, but also the Netherlands, still the aromatic amines and the polycyclic aromatic hydrocarbons are still used in a lot of inks, and they can be possibly carcinogenic. We know this from the respiratory tract. We actually don't know what it does in intradermal, so it's not we cannot say that this really causes skin cancer. So currently, it's only coincidental. What we also see is that we find sometimes the tattoo ink in the lymph nodes. Mostly if we do lymph node research for melanomas, we find a black lymph node that appears to be the tattoo ink. We have some pictures with skin cancer in tattoos. This is a melanoma. Very important that you recognize this and refer to us. What is also very important is that you don't tattoo over moles, because then we can, in the clinic, we cannot see the moles very good because of the ink. Squamous cell carcinoma, basal cell carcinoma, which are milder versions, but we do want to remove these. And here you can see a lymph node with pigment. So you can imagine that if you have a melanoma research, this is very concerning. You actually get very concerned by this, but this was actually just after tattooing. So there are a lot of challenges in studying the skin cancer and tattoo association. So first of all, it's very difficult to see the amount of ink that is used in a tattoo. And also 32% of the ink may already disappear in 6 weeks, let alone the systemic absorption. So the intradermal effect is unknown, as I just told you. We know this from the respiratory tract that some inks can be carcinogenic, but we don't know it from what it does in the skin. Tattoos are not medical registered, and we also a lot of the time don't know which ink is used. And of course, there are a lot of confounders. There's a lot of different factors that play a role in skin cancer, like sun exposure. And this makes it very difficult to make an association between skin cancer and tattoos. So this brings me already quite far into the presentation. We go to some other complications that I think you'll see quite often, like the scarring, the blowouts, phototoxic reaction, dyspigmentation, and also the tattoo removal. Here we can see a typical blowout. It's very good, very easy to treat with a pigment laser. It's the causes of if we tattoo too deep. Can also happen in PMU, which is very... and then the neurosensory reactions. This is one that we see at the clinic a lot. So what is very typical about this is that you don't see anything in this tattoo. It's a chronic persistent burning itch or pain. Most of the time it's directly after the tattooing, and it's not color specific. It's around the whole tattoo. And we cannot find anything. You cannot see anything on the skin, but also if you take a biopsy, you find nothing. And it doesn't react on the corticosteroids or protopic. It's very difficult to treat. It can be preceded by an infection, but most of the time we just don't really know how this happens. If you have a patient, a client that gives this, you can always refer to us. We can at least rule out a lot of other things, but it's a difficult one to treat. This was an allergic reaction on tattoo aftercare. It's not something we see a lot, but this woman used highly perfumated aftercare. She actually had an allergy on the perfume. So then we have the newer tattoo. So this is the blacklight tattoo. You probably know it. And this guy had actually on the blacklight ink, he had the hypersensitivity reaction. You cannot see it very well, but the eyes are a little bit red. So he had a lot of itch from this tattoo. I do think it's a very nice tattoo, actually. Then the eyeball tattooing. I don't know if anyone of you does this, but be aware that there are a lot of risks. So like blindness, blurred vision, photophobia. So it's very important that you are very aware of the risks that this gives, and you can tell your client also about all the risks that eyeball tattooing gives. I'll briefly go by the treatment. So if you refer a patient to us, we have a lot of options. Most of the time we can just treat it with local corticosteroids. Sometimes we have to inject it because, of course, the tattoo is a bit deeper and you cannot reach it with the cream. If there is an allergy, we most of the time need to do the CO2 laser. Because the pigment laser is a contraindication because you can actually reactivate the allergy. And then sometimes we have to treat with a systemic treatment, which are all lowering your immune system. And sometimes we have to do surgical options. Here you can see that the treatment with the local corticosteroids after a month, and it was actually already really, really good. This was a red ink allergy. This one we treated with intralesional corticosteroids with very good effect. You do sometimes see that people need to keep treating this with corticosteroids because otherwise the allergic reaction will just flame up again. This was a very difficult case we saw at the clinic. She had an allergic reaction at a PMU, 51-year-old woman. And her complaint started 2 months after the PMU with a lot of itch, pain, swelling, also infections, recurring infections on the lips. And actually nothing worked. We tried all the local topical possibilities and also a lot of systemic options, but nothing worked. And in the end, we decided to do the methotrexate with combined with laser treatment to actually also with the medication actually reduces the chance of the allergy being flamed up by the laser. And because we could use the laser, we could stop the methotrexate after a couple of months, and she was symptom-free. And then the CO2 laser, they do this in Amsterdam, and the goal is actually deleting all the red pigment. It requires 1 session under local anesthesia, and not all pigments need to be removed, only the one that you have an allergic reaction to. You can see here an example, but it leaves scarring. So you can actually see the 5% still vaguely on the arm. It didn't stop him from getting more tattoos. So this is my field of research, the tattoo removal. We actually got a lot of media attention in the last couple of weeks because we do a lot of research for the tattoo removal complications at this point in the tattoo clinic. So approximately 23% of the persons with a tattoo regret their tattoo, and 10% of them undergo the removal. The reasons are self-confidence, social reasons, family influence, or work-related. The gold standard for tattoo removal is the pigment laser, the QS or the Pico laser. And it works with selective photothermolysis, so it actually heatens the pigment cells so that they fall apart, and your body will resorb them through the lymph nodes. And this is how your tattoo will disappear most of the time without scarring. It's quite costly, out-of-pocket care, so it's very important that we advise patients well. We did a big research with skin therapists. So 180 skin therapists replied if they saw complications in their clinic. And they actually saw that all the treatments, the 1 in 10 treatments results in a complication. So it's, which are most of the time transient, like edema or blistering or hematoma, but sometimes dyspigmentation or an allergy or an infection. There were some influencing factors, so a skin therapist that treated higher skin types or ink colors other than black, PMU or previously treated tattoos were more likely to have some complications. And the years of experience of the skin practitioner or the interval between the laser treatments did not show any influence on the complication rate. These were some of the pictures we made at the clinic as well. So we can see the first picture, hyperpigmentation and pigment residue. And then the second picture, there's also some hypertrophic scarring. This is one we see at the clinic as well, the paradoxical darkening after laser treatment. So this happens especially in PMU and skin-colored tattoos because of the iron oxide and the titanium oxide pigments. So because with the laser, the metal the oxidation state gets different and you get some discoloration. So instead of fading, your tattoo will become very brownish dark. This is treatable also with different lasers, but it's a bit more difficult. So are there alternatives for tattoo removal? Yes. So there are a lot of caustic creams and ointments on the market, and also sometimes hair removal lasers are being used, which is not meant for tattoo removal. They're freely available. You can get a laser or these ointments without training on Amazon or eBay, for example. And it works by actually you create an ulcer. And with the crusts, you also get the tattoo pigments from the skin. It's simple, cheap, and fast, but it creates scars, ulceration. We see infections, and it's all not well studied. So we don't encourage these alternatives. As you can imagine, these scars, so the ink of the tattoo is intradermal. To get with a cream, to get to those pigments, you have to make sort of a hole for your whole upper skin into your dermis. And so that heals, it will always heal with scarring. So actually the only way to avoid scarring in tattoo removal is the laser. We asked the skin therapist that I just told you about also if they treated clients that used these alternative products. And 31% of the skin therapists reported to have seen clients that first tried to treat with alternative creams. And 56% also told to see complications in these clients. Also, we asked them about untrained practitioners. 87% of the skin therapists saw clients that were previously treated by untrained practitioners with a lot of complications. These are some complications we saw at the clinic from these alternative tattoo removal techniques. Hypertrophic scarring is the most frequent one, but it can be very extensive, as you can see. This was actually a woman who was treated by an untrained practitioner with an unfiltered laser beam. So she had a lot of scarring. The pigment wasn't gone, and so she was not very happy. Okay, so this brings me to the end. There was a lot of complications. So it's very uncommon. Still, the complication rate is normally tattooing just goes without any problems. But I think it's very important that we recognize the symptoms and refer them to us or another doctor to check if there's no systemic involvement, so we can get the proper management. All these complications can occur also when the correct technique is used in tattooing, and also when the good inks are used. So avoid alternative removal methods, just refer for laser removal. And when in doubt, just seek medical advice, contact us. You can always send an email or call us at the tattoo clinic. Yeah, so we also have a site, tattoosandhealth.com. You can also find all complications in tattoos there. So a very nice overview in English, I think. And you can always write me an email if you have any more questions about this presentation or you want to see some pictures more clearly. Thank you. Are there any questions? Yeah.
Are there less complications reported since there are the REACH inks, the new inks?
So that's a good question. We try to see if the skin therapists saw less complications after the REACH guidelines, but it's too early to tell. That was actually the conclusion of all the research that's done after the REACH guidelines, that it's still too early to tell. What I saw at the tattoo convention in Rome is that there's still a lot of allergens still in the inks, so it's like an ongoing process. But it's I'm very curious to see, yeah.
So I think that the REACH colors were taken place because of when you laser them, or that's what I heard at least, that when you laser them, it could cause skin cancer. That's something I heard, but I'm not sure if it's founded. Is that why we are working with these REACH colors, in your opinion?
No, I think it's also because of the allergens that in the ink. So they do a lot of research which pigments cause allergies, and so they also removed a lot of the most common allergens from the inks that are in REACH now after REACH. So what you say, the carcinogenic, I think they did look at it, but it's still in a lot of inks. We still find this, and we just don't know the effects on the relation with skin cancer. So it's not really because of it's not entirely true, no, because there also before REACH there was no association between skin cancer and tattoos. Yeah. Yeah, so it's most of the time for the allergies, actually. Yeah, yeah.
I have a question, especially with the raised, with just the black ink. Like, if it's, because I've seen more often that a tattoo is a bit like 3D kind of and a bit more raised. Is that always a reason for concern, or if it's just that it settles into the skin later on?
Yeah, it's a good question because a lot of you see in freshly put tattoos there is also a lot of swelling, and sometimes because there's too much ink, we can get these reactions as well. So sometimes I think if it's not if it's not transient, you can always refer. But normally, this will disappear within a couple of weeks. So if it stays longer than that, we should really reevaluate. But what I told you, most of the time it's no sarcoidosis. It's just a black tattoo reaction. But we cannot be sure. Yeah.
At the beginning, when you talked about the autoimmune diseases, you showed one person who got psoriasis after a new tattoo. How does this happen?
So that's actually the Kapner phenomenon that I was telling you about. So psoriasis is something you have from your genetics. It's not caused by the tattoo, but sometimes it can be the first presentation of a psoriasis because you make the trauma to the skin, and then there the psoriasis goes. So actually, if you make a scratch, that is something that the psoriasis will go to as well. That's called the Kapner phenomenon. And because with the needle, you make trauma to the skin, sometimes the psoriasis will go into the tattoo, and that is then the first presentation. It don't have to be, if you're known with psoriasis, this is something you can see. Yeah. Yeah. Okay. Thank you.
Thank you, Mila.